Renata was first diagnosed with autoimmune hepatitis 20 years ago, but it didn't cause her any problems for a long time.
Die muss wohl geschlummert haben in mir.
It must have been hiding in me, and nobody was able to discover it. Then in July of 2020, I had similar problems again, so I had liver blood tests. And then I got diagnosed with autoimmune hepatitis.
Eine Autoimmunhepatitis ist.
Since her diagnosis, Daniela has been living with autoimmune hepatitis for 16 years. It had been a puzzling journey up to that point.
Ich habe ständige Auf und Abs gehabt.
I had constant ups and downs with elevated liver enzymes, but then they returned to normal. I would be admitted to hospital, then the results were normal again. It went on like that for a year and a half until finally I ended up in the right hands. And then I received the diagnosis of autoimmune hepatitis. Two very different courses, but one disease. Autoimmune hepatitis has many faces.
It may be a different disease in one patient from another, and even within one patient, the disease may change its character over time. It can start as an acute hepatitis, so an acute inflammation of the liver, where the immune system, for some reasons that we don't understand, attacks the body's own liver cells, and this causes inflammation and damage, like an acute viral hepatitis, but without a virus. But the disease can also run a very mild course, and the patient may not actually feel anything, may have a little fatigue, less energy, maybe some joint pains can sometimes be observed. And if we then look into the liver, we find in the liver a continuous inflammatory process. And whenever you have inflammation somewhere and that inflammation settles down, the body tends to make a scar to stop the inflammation. And scars in the liver can eventually result in cirrhosis. That's why it's so important to make the diagnosis and why it's so important to treat this disease effectively, and we can treat it very effectively.
Autoimmune hepatitis is a common autoimmune disease of the liver. 1 to 2 out of 10,000 people are affected. Women 3 times more often than men. As with any autoimmune disease, cells of the immune system attack and destroy the cells of the liver. This is triggered by various external and internal factors. These factors can include viral infections of the liver, certain drugs, or changes in the microbiome, which is the bacterial colonization of the intestine. Malfunction of the immune cells can also trigger autoimmune hepatitis. Renata's liver disease had apparently been cured at that time. She didn't think about it for many years, but then some symptoms began and they could not be explained. I was just tired all the time, and I'm actually a very active person otherwise. I had a rash on my arms that didn't go away. I was less and less able for sports. The hair loss seemed endless. There were just too many individual things that no one could explain to me. I also thought it was some autoimmune thing, and then it ended with a lupus diagnosis.
Endlich gab es die Diagnose Lupus.
Finally, she was recommended to go to the University Medical Center in Hamburg, Germany.
This patient had a history of some autoimmune disease. She was initially diagnosed as lupus disease or lupus, and then she had high liver enzymes. That is always suspicious that that could be an autoimmune hepatitis. In the laboratory, the features were quite typical, with quite high liver enzymes and very high IgG. Immunoglobulin G is a typical feature of autoimmune hepatitis.
Then it was very quickly decided that it was autoimmune hepatitis and that it had come back again after 20 years. Back then, however, the difference was that I was yellow for 4 weeks, and now not at all. In Daniela's case, the symptoms were also largely inconspicuous. Everything was becoming more and more difficult for her. She was only 37 years old at the time.
Ich habe sehr unter Appetitlosigkeit gelitten, dann unter Abgeschlagenheit und Müdigkeit.
I suffered a lot from having no appetite, then from fatigue and tiredness. For example, when I was so exhausted, I didn't want to get up and do an everyday task like the dishes. And it went on like that. And the worst point for me was when I woke up one morning and got such a fright. I noticed that the whites of my eyes had turned yellow.
Augenweiße in Gelb verfärbt hatte.
The symptoms of autoimmune hepatitis are often atypical: fatigue and loss of appetite, joint pain, usually in several joints, what is known as liver skin signs, for example, red coloration of the palms of the hands, and in the early phase, sometimes yellowing of the eyes or skin, also known as jaundice or icterus.
Jaundice can be the presenting feature in autoimmune hepatitis. It occurs in about a third of the patients with autoimmune hepatitis, maybe a little less, those that come with an acute inflammation. They often have jaundice even as a presenting feature. It's the first thing they notice or their family notices and makes them go to see the doctor. There's a long differential diagnosis of jaundice, but acute jaundice is often due to acute hepatitis. And within the group of acute hepatitis, the most common forms are viral, drug-induced, or autoimmune. So you always have to think of autoimmune hepatitis when you have a newly developed jaundice.
But for a long time, no one thought of autoimmune hepatitis in Daniela's case, even though she was repeatedly ill and her liver enzymes were greatly elevated. And then all the signs of illness disappeared again and again on their own, without a diagnosis. 2 years after her symptoms first appeared, Daniela finally sought advice at the University Medical Center Hamburg in Germany. That was 16 years ago.
This patient had very typical features because she had several bouts of acute icteric hepatitis. She had an attack of jaundice, high liver enzymes. People thought it was drug-induced. It improved again without the drugs. And so everybody was happy, but a few months later, the same thing happened again. This is always highly suspicious of an autoimmune hepatitis. Several attacks of acute hepatitis without an obvious cause could very well be autoimmune hepatitis.
To confirm the diagnosis of autoimmune hepatitis, the first step is to do liver blood tests and determine immunoglobulin G. Elevated levels indicate autoimmune hepatitis. Then, further information can be gained by blood test to determine the presence of autoantibodies. But a tissue sample from the liver is essential to diagnose autoimmune hepatitis. Liver tissue can be obtained with a direct view on the liver by mini laparoscopy, and the liver cells can then be examined under the microscope. Normally, this shows typical signs of inflammation and an accumulation of immune cells. It confirms autoimmune hepatitis.
In 2005,
In 2005, I was diagnosed with autoimmune hepatitis. It was very important for me to know what kind of disease I was dealing with, because nothing is worse than struggling with something when you don't even know its name. And it really was a huge relief, because I finally knew what it was all about. And then you know what you can do about it and how to do it. Because those constant ups and downs, feeling bad, not feeling bad, turning yellow, then not turning yellow, hospital stays, that is stressful. That's a huge stress factor, emotionally, a huge stress factor in that phase before you have the diagnosis.
bis du die Diagnose hast.
Finally, Renate also underwent liver biopsy, which confirmed the suspicion. The autoimmune hepatitis diagnosis.
Ich war überhaupt nicht erstaunt.
I was not at all surprised to find out that that is what it was. After all, nothing was hurting. I mean, it's not like I had any pain and I was just tired. So now someone comes and says it's the liver and it can be treated.
Und das kann man behandeln.
Her therapy right at the start was a high dose of cortisone. That controls the acute inflammation in her liver as quickly as possible. And the effect was soon noticeable for Renate.
Ich habe das Cortison genommen und das war.
I took the cortisone and it changed immediately. I became very active again. I noticed when climbing stairs, I had more energy again, which had decreased so much in all of my fitness classes, for example. And suddenly it was all fine again. Then I had the feeling that it will be just like before. I'm going to treat it now, and that's that. Done. At the start, autoimmune hepatitis is always treated with cortisone, usually prednisolone. That is the basis of the therapy. Azathioprine is added after about 10 days. Like cortisone, this drug suppresses the immune response, so the cortisone dose can be reduced to prevent side effects. In some cases, other immune drugs are used.
The good news about autoimmune hepatitis is it almost always responds to treatment. In fact, it usually responds very well to treatment. And it responds so well that the response to treatment is confirming the diagnosis. So if you have the suspicion of autoimmune hepatitis, the doctor may decide to just do a trial of treatment, which at the beginning is always steroids. So you give steroids in various doses and see that liver enzymes get much better, and often the patient after a few days feels much better as well. This response confirms the diagnosis to a strong degree. It's not 100%, but it's very, very encouraging. And it's also encouraging for the patient to know things will get better.
But for some patients with autoimmune hepatitis, standard therapy is not enough in the long run. That's how it was for Daniela.
Der Therapieverlauf bei meiner Autoimmunhepatitis.
Treatment for my autoimmune hepatitis went very well at the beginning. I reacted to the medication as I should have, and then after about 5 or 6 years, everything got worse. I needed additional medication, which I then received in the form of an infusion.
Ein zusätzliches Medikament bekommen musste, was ich dann in Form von einer Infusion erhalten habe.
Her liver enzymes had risen again, and the symptoms were back. For the past 10 years, she has been coming to the clinic once a week to receive infusion.
The drug is infliximab. It's a monoclonal antibody against an inflammation messenger, a cytokine. And that is a now well-tested drug in a number of immune diseases. And we have shown many years ago that in patients who are very difficult to treat, this drug can save the patient. And it's doing a wonderful job with our patient who is living a full life despite having such an aggressive disease.
Ich kann essen, was ich
I can
will.
eat what I want. I can do the sports I want to do. Professionally, I am on top. I no longer have any physical impairments, like those I mentioned, fatigue, exhaustion. This therapy means they are just gone. I really feel like a fit and healthy person, and I can do anything I want.
Und ich kann alles machen, was ich will.
Daniela leads a good life with her autoimmune hepatitis. She has come to terms with the fact that probably she will always need her medication. But that was a challenge.
Every patient with a chronic disease thinks, do I really need to take my drugs all my life? Can I reduce the drugs? Can I withdraw the drugs? In some patients this is possible, but it shouldn't be tried earlier than after 2 or 3 years of full remission of the disease. So if everything is normal, liver enzymes normal, IgG is normal, and you're taking a constant low dose of drugs, your doctor and you can and probably should try to slowly taper the drugs completely, but should be watchful because at least half of these patients will have a relapse after withdrawal. It's extremely important that such a trial of withdrawal is done in good understanding between doctor and patient, because the earlier you see the relapse, the easier it is to treat the relapse.
Renata has now been undergoing therapy for 6 months. It agrees with her, and it is working well. Most recently, she could reduce the cortisone to a minimal dose.
Diese autoimmune Hepatitis.
To me, this autoimmune hepatitis does not play a role anymore. I just have the feeling that it has been treated, and that's that. I am sure that's nonsense from a medical point of view, but that is how I see it. I simply feel like living, and as long as I have my old life back, as I do now, it doesn't matter to me. I don't think about this hepatitis for a minute.
Minute an diese Hepatitis.